a Biomedical Innovator Scholar really gives me the opportunity to participate and be really involved in undergraduate research, especially to such a level, as well as really getting that opportunity to interact with healthcare professionals throughout the Mayo Clinic Health System and really kind of getting that foot in the door.
I see being a biomedical innovator as being an honor. You're trying to explore the new of what hasn't been done. So it's just an honor to be selected out of such a small group of people to kind of lead the charge on this biomedical front of innovation.
These are some of the top students that come to the university. They're excited, they're full of great ideas, they work incredibly hard. They come into the laboratory and they're in the lab the first week of their first semester in college. And they begin to function as, to be honest with you, what a first-year graduate student would function as.
I never imagined that I would be working in the lab with faculty in collaboration with Mayo Clinic my first year on campus. Being selected as an Innovator Scholar also comes with a scholarship that's renewable for 4 years, and it just takes off a lot of the financial burden of having to think about how you're going to pay for each semester, so I can focus on research and preparing myself to really take advantage of what I can learn in my classes and what I can learn from my peers and the research that I'm doing as part of the program.
Just to be able to know that my research could have even a potential impact in the future is really, really motivating and just influential in what I want to do with my future life.
You have the opportunity to get at UW-EC what you're not going to get at a Big Ten, Pac-10, East Coast school. Because as a first or second year student, you're helping run research.
Another bullet point under what the program offers is being able to shadow physicians at Mayo Clinic through the MedX program.
When you go in person and you can see it applied firsthand, it kind of takes a whole new perspective on it and you're able to see how cool it actually is.
I think it's motivating and helps inspire students to see the real world benefit of what they're working on, especially when it can help patients and potentially improve upon techniques that are already in place, make things safer or more efficient for the patients.
Being able to apply this research in real life, in real time, it makes it more important to you because you can see how this can change someone's life.
Having the opportunity to shadow different physicians. I know I shadowed a cardiologist, an orthopedic hand surgeon, a behavioral psychologist, so getting that kind of overview of many different specialties really gave me more in-depth knowledge of different areas I can go in the future.
Medical pathways are very specialized, and we spend so much time learning all of the medicine that goes into taking care of patients that we're not able to really keep up on many of the other fields. And of course, that's what the faculty here at UW-EC do. Day in and day out, they are really experts in their own fields, and finding the overlap, I think, really allows both us on the medical side to sort of see what improvements and advances have been made on kind of the other fields and specialties. At the same time, we hope that our participation really gives the faculty and students here some real world data that they can sink their teeth into and potentially prove that what they're doing is more than just theoretical. It actually has real world implications and real world benefits to people.
In the medical field, you're going to be dealing with so many different types of people. You're going to be dealing with, obviously, the patient at hand. You're going to be dealing with other doctors, other nurses, different sub-level, different specialties, all that stuff. And I think it's kind of preparing us all for whatever career path that we go into.
When I started my career as a polymer scientist, I never expected to be working on a project that was in collaboration with a medical doctor that has such clear ties and a clear goal for a biomedical application.
For me, it's exciting. I've been doing 3D printing for a long time, but not necessarily towards medical applications. And so this is an opportunity to sort of combine my interests, my expertise with someone from Mayo Clinic. And so that's great for me. And then get to work with some great students. The students that I have been excellent, really pushed the project forward. And so it's really a win for everyone.
You're not going to get a program like this at really any other school. And the opportunity to be able to work with active researchers, have mentoring from established docs, and do all of this when you're a freshman or a sophomore is just a phenomenal experience.
I never imagined that I'd be working on projects in collaboration with Mayo Clinic with faculty right away. That's been a really unique experience to kind of help me see, like I said, that the things I'm learning are applied to actually helping people.